Spirituality is Chapter 35 in Potter and Perry. Our principles of spirituality are spiritual well-being, health, and spiritual distress. And for the nurse in the hospital working with hospice patients, spiritual distress is often one that we will encounter in our nursing career. Spiritual well-being is sometimes religion-specific, helps individuals achieve that balance needed to maintain health and well-being to cope with illness. Spiritual well-being has a positive effect on health. There are research studies showing people with positive spiritual well-being heal faster and have a positive outlook that encourages the mind and body together. The relationship between spirituality and healing is not well understood, but as I said, there is that link that we see oftentimes in the healthcare community. Spiritual distress is that inability to experience or integrate the meaning and purpose in life. Many of your terminally ill patients will have uncertainty about death and what it means specifically for them, and they will ask such questions as, why is this happening to me? Or, I have no reason to live, when they have spiritual distress. Our assessment then is subjective. It means different things to different people. Does the person have a religious source or guidance that conflicts maybe with the medical treatment plans? Jehovah's Witness not wanting a blood transfusion would be one example that we think of with that. Our nursing diagnoses that are listed here, I would like to focus on complicated grief, that risk for spiritual distress, sometimes poor relationships or a recent loss they've experienced, or maybe it's mental or physical illness that is causing them to have that. Complicated grief is where they are having difficulty with coming up with, how they want to grieve in an appropriate way, or it's just very difficult for them. In the planning phase, we need to ask them what are their goals and then work with other parts of the healthcare team to collaborate to help that patient in the best way possible for their spirituality needs. Implementation is spending time with them, looking at it holistically. Maybe they don't want a blood transfusion, but there are other things that we can do to promote their feeling better, getting well. And then look at their rituals and support systems that they have. Diet is one that we see oftentimes with the Catholics during Lent when they don't want to have meat on Friday as part of that, or the Jewish, as we learned in nutrition, where they don't ever mix the meat and the milk products together on the same dishes or in the same meal. Our evaluation then is to look at their lifelong goal. It's very subjective, and so the outcomes are going to very much depend on that purpose and their individual for them. Why should we care? As this graph looks at, there are issues around death and dying in many cultures. It's very difficult to ask patients about some of these very sensitive issues, and we cannot assume just because somebody is of one religion that we know what type of care they're going to want. So if you have a patient, we just need to ask them what are their needs. Some patients, after death, the family will wash the body and wrap it and prepare it for burial, whereas other cultures, perhaps they just want the funeral home called and they've made prearranged plans. As far as the Buddhists, their belief about death and mourning, they have the rite of passage. When we look at the care of the dying for the Buddhists, then they may refuse the painkillers or sedatives at the time of death. And as I said, these are generalizations for the different types of religions that we see, and we would specifically need to ask each patient what is their wish. Just because they're a Buddhist or a Christian doesn't mean that we know exactly what they're going to want for their. This is a Buddhist funeral ceremony. As far as Christian Science, they have no rituals. Last rites may be appropriate for death, and they rely on God for healing, oftentimes rather than medicine or surgery for the Christian Science. Their practices for the Christian funeral are going to vary from church to church, and each person, many of them will have readings, hymns, or prayers. Oftentimes black clothes is the most appropriate thing to wear for that. During Christian interment, then they will have the prayers at the graveside or with the urn if they're cremated. For a Hindu death, they very much want to die at home, and the patient is placed on the floor for their final few breaths, which is a little different than what we're used to. A couple of the other Hindu practices, they don't like postmortem cares, and cremation is oftentimes seen for the Hindu. And this is just a picture depicting that. For the Islam, their beliefs about death then or resurrection, they are never cremated. The care of dying for the Muslim, oftentimes they want to face Mecca, and the family or Muslim rites, prayers around the bedside are talked about. For death of the Muslim, do not wash the body, cut the hair or nails. Again, they wrap it in the plain white sheet, and usually they're buried within 24 hours of death. They have some special beads, Muslim dhikr beads, that are used, done in repeating certain formulas, and that's in praise of Allah. As far as our Jehovah Witness, they have no last rites. Postmortem is family choice. For Judaism, the belief about death, there is no immediate life after death. For the Judaism and their care of the dying, then oftentimes a rabbi will be called to hear the confession and bring comfort for them. As far as death for the Judaism faith, then the oldest son is usually the one that will close the patient's eyes or mouth. The feet are pointed toward the doorway, or a candle is lit, and then they refuse postmortem cares unless it has to be done. As far as the Mormon religion, last rites are appropriate. They prefer burial, and the postmortem is a family choice that they do have. This is a picture of Nepal, where I'm not sure what their religion is, but we can see then a cremation ceremony. Our big thing for the care of the dying, I won't ask a lot of very specific questions related to the different types of religion. They can be found in Potter and Perry in that graph in the chapter, but the biggest thing to remember is the respect for their wishes, to ask them. There is a form that can be filled out called the 5 rights, or the wishes, 5 wishes, and that is very specific as to what the patient wants, and you want to complete that before the dying process starts so that they can have a chance to visit with their family about their wishes and needs. Some of them do not want to be turned. They simply, if they're resting comfortably, they don't care about skin breakdown. The family will say, don't turn them, mom's just, resting very comfortably. Other ones have very specific wants for IV hydration, oxygen, suctioning, some of those types of things that are often encountered for care of the dying patient. Some of the terminology we will see for this unit is spirituality, the well-being, and like I said, the nursing diagnosis of spiritual distress, our hope and faith, and then other considerations. For the older adult, they oftentimes are adjusting to the death and dying. When you get to be 90, I think many of their friends have died. They think about funerals. They may plan their funeral and have everything ready, prepaid, whereas the young person might not be thinking about death, and it might come as a very unexpected thing, and the family has then a lot of issues and a lot of planning to do because that wasn't done by the person ahead of time. That is it. Here's the bibliography for some of the pictures that came from this PowerPoint slide. The big thing is to ask the patient, talk with the family, and do a lot of good communication for that person as far as their spirituality needs. I would suggest that you complete the questions at the end of the chapter in Potter and Perry for an idea or sampling of what might be asked from this chapter on the test. Thank you. I hope you've enjoyed this PowerPoint. Have a great day.